Hello everyone, Dr. Suneel Dhand. Welcome to another video. I'd like to think those of you who follow me here do so because you want open, honest debate. You want to arrive at your own conclusions. You don't want things shoved in your face. You want to live in reality. You want to hear things which are not being widely reported in our corrupted mainstream media. On that note, I want to share with you a story which was reported in the mainstream media in the United Kingdom. Hasn't yet arrived to a large degree in the United States, but I think that may well change. It's a rather disturbing story regarding deadly streptococcal infections in children. Let me share with you this. This was published on the BBC. 6 children die with Streptococcus A infection, Strep A bacterial infection. 6 children have died with an invasive condition caused by Strep A, including 5 under 10-year-olds in England since September, the UK Health Security Agency has said. Streptococcus group A is a ubiquitous bacteria and commonly causes infections including throat infections, upper respiratory infections, and also skin infections. Strep A infections are normally mild, but people can become seriously ill. Parents concerned about their child's symptoms should seek medical advice. While still uncommon, there has been an increase in invasive Group A strep cases this year, particularly in children under 10. It then talks about the tragic cases of young children who have died from the illness. Infections caused by Group A strep bacteria are usually mild, with symptoms like a sore throat or skin infections, like I just said. The bug can also cause scarlet fever. However, in a very small number of cases, Group A strep infection can get deeper into the body, for example, into the lungs and bloodstream. Whenever an infection, in this case a bacteria, gets into the bloodstream, it is very serious indeed. That is what we call septicemia. There are a range of symptoms which may be a sign of an invasive infection, including high fever, poor appetite, dehydration, altered behavior, and feeling very sleepy. The latest increase is most likely related to high amounts of the bug circulating and increased social mixing. So why could we be seeing these increases in Strep A infection then? Well, a clinical senior lecturer at Imperial College London said during the first 2 years of the pandemic, we saw very little Group A strep, and it has started to circulate again in 2022 as restrictions have been lifted. Usually we see a high number of cases in late spring or early summer, often after chickenpox infections. High numbers at this time of year are unusual and probably occurring as normal seasonality has not yet returned. The article then goes on to talk about the signs of scarlet fever and what is Strep A, some general facts. I will share the article with you down below. But I do want to share another piece with you, this time focusing on one tragic case. So this was on LBC, which is also a UK publication. Broken father of girl 4 on ventilator with Strep A warns parents not to hesitate over symptoms. The broken father of a 4-year-old girl who is fighting for her life on a ventilator with Strep A has warned parents not to hesitate over quickly developing symptoms. This little girl was described as the poorliest girl in England after her health deteriorated in the space of just 1 weekend after getting the bug. This is a very important point. Infections, often especially in children, can progress very quickly indeed, and parents have to be on the lookout for warning signs. Her father said she had been dancing with friends on Friday evening, but by Monday was instead fighting for her life on a ventilator at a major children's hospital in Liverpool. She went from feeling a little under the weather on the Saturday before her condition worsened on Sunday, and she needed emergency care by Monday. And this article also says 6 children have now died of Strep A this winter. Serious cases of normally harmless bacterial infection Strep A are nearly 5 times higher among young children than pre-pandemic, officials have said. 5 times higher, 5 times higher. That is a staggering statistical increase. And some experts have said the rise could be linked to lockdown, meaning children have not exposed to each other's germs over the past 2 years. That could weaken their natural immune defenses, some scientists said. It's not just some scientists. There are many people in the medical and scientific field who subscribe to this hypothesis that children not having their regular mixing, regular exposures is causing problems now, and we are now seeing the effects of that. A microbiologist at the University of Reading said you'll be aware of lockdowns having an effect on immunity for things like flu. The principle is the same. A lack of mixing in kids may have caused a drop in population-wide immunity that could increase transmission in that age group. I'm currently unaware that it's some horrible new strain. In fact, I would bet that it's not. I do expect there to be further cases over the coming weeks and probably months. Another infectious disease expert here at Reading University who added, "Death in young kids is indeed tragic, but I don't, unfortunately to say, see it as out of the ordinary yet." He went on, "It is possible that there has been a lockdown-related reduction in natural immunity, and we are now seeing a bounce with school attendance." So again, this is a tragic story. Young children dying of streptococcal infection in higher numbers than previous years. So what could really be causing this? Well, I'd like to share a few thoughts with you. Now, firstly, of course, we're hearing this story. Perhaps by the time my video goes out, more children have been seriously affected by Streptococcus group A. But consider these three things. Number one, as goes Europe and the United Kingdom, so goes the United States a few weeks later. We've seen this repeatedly over the last 2.5 years. So while we haven't seen this story much reported yet in the United States, watch this space. Let's hope it doesn't happen here in the United States, but the expectation is that it probably will if we're seeing it in Europe. Secondly, coming back to this point on lockdowns having a huge effect. Now, it is unbelievable that we had a select group of people in charge of lockdowns, medical people who all thought the same way. They were engaged in groupthink. And we still have these same people in charge now who think that the answer to a pandemic is lockdowns and restrictions. They are so myopic, they cannot see any downstream consequences or devastating effects for what they are advocating for. And the third point is this. Now, remember, this lockdown hypothesis theory hasn't been proven, but it would make sense logically and scientifically, especially when we look at countries that didn't lock down to the same degree as many Western countries, and they are not seeing similar huge surges in many of the pathogens that we are in the West. But of course, in science, we have to always keep an open mind. Could there be any other unique related factors over the last 2.5 years? Any unique pandemic factors that could also be contributing? But keep this in mind. If indeed the fact that many Western countries locked down for a large amount of time is now leading to these devastating health consequences, keep in mind that those same people who advocated for very harsh restrictions and lockdowns are still in charge in many of these countries. And we have to say, if ever this happens again, heaven forbid, but if it does, and it probably will one day, never again will we go down this road of extreme lockdowns without realizing that that comes with other potential consequences. We cannot be so myopic in how we look at things in life, especially when it comes to health and well-being. Those are my thoughts. Thank you very much. Let me know your thoughts down below. Dr. Suneel Dhand. Do hit the subscribe button for more similar videos in the future. Also hit the bell button so you get notified when I make more videos. Remember, modern mainstream culture will make you very sick very fast. Sadly, there are significant elements of the establishment and medical establishment who benefit from a population that is as sick, as chronically unwell and obese as possible. Sadly, a lot of healthcare and medicine has become very corrupted indeed, and fewer things are to be more cherished than our freedom. Also, come follow me on my uncensored platform, locals.com. That link is down below, where we have more open, interesting discussions about health, about well-being, about pandemic response, about the corruption in medicine, and we do so away from this environment of big tech, censorship, and silencing. It is a disgrace. I need to say that in the United States, but I do. We will talk again very soon.